in this case. So we did the angio, and another part of the technique, which is not a hand technique, is to really look at your images. In this case, it's more obvious here on this image now, but a lot of times the GI bleeds are subtle, dude. I frequently, if it's during the day, I usually ask one of my partners to sit in the control room and look at the images with me.
That's wise.
It's very easy to miss stuff like in the lab. You're there and you're looking at the screen.
I had one maybe 4 months ago where you couldn't see it at all. And the only finding that I missed was you can actually see on some of the later runs, just contrast moving in small bowel. It just looked like oral contrast, but it was, I knew it was bleeding from somewhere and I just missed it.
Oh yeah. No, I had something similar actually more recently than that. Yeah.
For the only time ever.
Only time, right? Yeah. No, I mean, it's very important to just kind of, I film you can go I film at 4 frames per second to 6. I mean, I sometimes do 6 just because, but I know that's more radiation, but it's just important. I mean, there's a lot of little, it can be really, really subtle. And I think having 2 pairs of eyes are helpful.
That's smart. I want to try that.
Yeah, try that, because there's been multiple times I'm like, oh, it's negative. And my partner's like, oh, what about that? And then, that's real.
It's so easy to read somebody else's angiograms.
Yeah, there's so much more, subconscious
you're locked
factors
in
in
when
play.
You're doing your own.
You're looking at one thing, and as we saw on the prior run is bowel gas is so, such the best mimicker, of anything. So, you can look at it on native. Luckily in this case, I mean, you can see that there's extrav in that right lower quadrant right there. And, and then although some of my partners will then take the base catheter as far as they'll go into the artery. I kind of just go from a microcatheter at this point. I'll get a little bit more stable access, maybe push that Cobra in. Even the Cobra is so nice, you can, not that I recommend everyone do it, but you can puff and push and you don't have to put a wire sometimes, but it loves the SMA for sure. And you can, get selective. I use microcatheter work for all my GI bleeds. And,
Michael, when you're trying to get the Cobra further down, are you doing it over a glide that you get down further down, or what wire are you using to try and get it? Glide wire?
Yeah. I mean, a regular glide wire.
I take that back. It's whatever wire I have in the catheter at that moment. I've done it over a Benson. I've done it over Glide Advantage. I've done it over Glide. It's worked with all of them. Wire.
It's like, with with all glide wires, be careful. I mean, you don't want to push that wire and cause another GI bleed, right? But I love the glide wire, the regular and stiff. I mean, that's my workhorse wire for most things.
But I'm with Sabeen. I'm getting out there farther with the microcatheter. If I haven't gotten out there already with the Cobra, I usually only do it if I've gotten kicked out while working in the microcatheter once.
Smart.
Yeah.
Smart. And even, with a microcatheter where you are, even in this position now, with the wire in the microcatheter, you could push the Cobra over and just get a little stable access to, or whatever, base catheter. But I just get selective, and we're just looking for we want to get as selective as possible in lower GI bleeds, and the more selective the better. And so I typically try to use a 150 cm microcatheter. I think most of the time, because I've been burned in the past that a 130 could be a little bit short, especially going really distal. Mike, use the same way?
Yeah. I've also gotten burned. Only once, but once was enough.
Oh yeah. And I'm a big believer of using overlay and roadmap. I mean, some people, I know don't do that much, but I think it helps you. I mean, why guess? And why not? It can be hard when the patient's breathing a lot or whatnot. But if you can use overlay in that, it really just decreases your time than just thinking that where the wire's going. And so that's what I use. So here we're just getting really, really selective right into this bleed, which turned out to be a diverticular bleed in the cecum.